Welcome to the second annual Health Policy Summit. I'm Amy Rowling-McGee, the president of HPIO, the Health Policy Institute of Ohio, and I'm happy to see so many familiar faces and so many new faces. HPIO is a nonpartisan, independent, nonprofit organization. Our mission is to advance evidence-informed policies that improve health, achieve equity, and lead to sustainable healthcare spending here in our state. The theme of today's summit is prioritizing what works, a focus on policies with the greatest return on investment. But let's start by acknowledging some of the realities we're facing today. Some of you have experienced funding reductions due to cuts in federal or state grants and work in organizations that have had to lay off staff. Some of you are experiencing anxiety about future loss of funds related to the shutdown of the federal government or potential loss of local funding sources or the impact of recently enacted federal and state laws. And many of you are worried about how these and other policy changes may affect the lives of Ohioans who you serve. We know that no summit, conference, or workshop will change these realities. Yet we're all here today. We've shown up. We've shown up to better understand how these federal and state policies will impact Ohioans, to learn skills that will enable us to plan and make decisions strategically, to be inspired by programs and approaches that are working. There are a lot of knowledgeable and passionate people in this room who serve Ohioans of every age and in every region of our beautiful state. We all, through our service, are united by a common purpose, making sure that our policies and systems enable every Ohioan to reach their full health potential. Our team hopes that when you leave today, you feel better prepared to face our challenges together. Before we get started with our agenda, I have some housekeeping details that I'm going to review. First, I'd love to thank our funders. This slide shows all of our core funders who, through their philanthropic contributions, enable us to do all of the work that we produce every single week. And then we're also very pleased to have financial support from our educational event sponsors who have enabled us to put on today's summit and to host educational webinars throughout the year. We also want to thank our clients who have engaged our expertise in planning and assessment, program and policy evaluation, and policy research and analysis. On page 11 of your programs, there are more details about that work, and including some examples of our recent contract work. We just finished up a community health needs assessment for the tri-state region of Cincinnati. We finished a behavioral health equity assessment for Delaware and Morrow counties, and we worked with Oral Health Ohio on the state oral health plan a couple of years ago. And here are some housekeeping details. There's a map on your agenda on the back so that you can easily find the breakout sessions and workshops. This facility is amazing. If you're attending any of the sessions that are held in the culinary kitchen, the instructional kitchen, you're in for a treat. I've never been in a room that has all of the elements that has. And members of our staff can direct you to any of those rooms. There's also signage throughout the building. All meals are going to be available right outside the ballroom. We invite you to visit the poster sessions that are just past the registration table. Those are going to be available throughout the day, and those exhibitors will have tickets, raffle tickets for a raffle drawing that we will hold at the end of the day, and you may be one of the lucky winners of a copy of a book written by our final speakers of the day. It's titled Infant Mortality and Other Wicked Problems, a community-driven approach to creating change. We have a quiet room available for those of you who need to take a call or work for a few minutes in between the sessions, and it's right past the gallery. Again, just ask a staff person for directions to that. If you need access to a lactation room, we also have that available. Again, talk to a staff person or look at that map. This program has been approved by the National Association of Social Workers, Ohio chapter, for 5.5 social work CEU credits, by the Ohio Supreme Court for 5.5 continuing legal education credits, and the National Commission for Health Education Credentialing for 5.5 hours of continuing education for CHES and MCHES. If you're receiving these credits, be sure to sign in at the registration table, and you'll need to complete and turn in your evaluation forms at the end of the day in order to get credit. And for those of you who are here for CLE, we will read the activity code at the end of the session. And then you'll have to turn in your confirmation form in order to receive credit for CLE. There's a QR code in your program to complete an evaluation for all of the sessions today. The plenary session and the evaluation of your overall experience are coupled together on one form. Please take a minute to complete that at the end of the day. We do take evaluation very seriously. We used the insights that we gathered through last year's evaluation to plan this year's. That information helps us to just continually improve the events that we offer. And we will continue to remind you of that throughout the day. All right, so our first speaker, who comes highly recommended by those who have worked with him here in our state, is Dr. Michael Gillette. He's the founder of Bioethical Services of Virginia. His keynote presentation will focus on an ethical framework for decision-making in a time of scarce resources. He's an ethics expert. He contracts with healthcare organizations and other agencies to provide ethics case consultations and policy work. He graduated magna cum laude from Brandeis University with majors in philosophy and classical Greek, where he was elected Phi Beta Kappa. He earned his master's degree and PhD in philosophy at Brown University. He's taught classes in colleges and universities, published articles in the field of clinical ethics, and has received several teaching awards. And he was elected 3 times to the City Council of Lynchburg, Virginia. He's one of 2 of our speakers today, plenary speakers, who has served in local elected office. And he also served 2 terms as mayor of the city. So please join me in welcoming Dr. Gillette.
Thank you. Good morning, everybody. I'm going to do 6 hours worth of material here in about 30 minutes, so it's going to be a bit of a whirlwind. But even though that's true, I would like very much for this to be interactive. So do not hold questions. If you've got a question, a comment, an argument, please bring it on. As you heard in the introduction, I do clinical ethics for a living. You might be a little scared because you stressed the fact that I'm a philosopher by training, and you're like, what? Do we care about what a philosopher has to say? But I want to assure you that my work is highly practical, highly applicable to the real world. I was a college professor in my early days, but I resigned my teaching position after I got tenure in order to do consulting work full time, and I've been doing that for more decades than I'd like to admit. I am well aware of what's going on in Ohio. I have been doing consulting work generally in clinical ethics, but I have a lot of experience working on the allocation of resources that really, we're going to have a case in a moment that sort of kicked this off quite a long time ago. But I was invited to come to Ohio probably about 10, 12 years, my friend, 10 or so years ago to talk about how resources could best be used when we were concerned that shortages were on their way. Interestingly, some of the scarcity that was anticipated did not actually occur. COVID, I hate to say this, COVID came to the rescue in many ways by loosening up some funding streams. But we now see that in Ohio, things are changing in a way that accentuate the risk for funding cuts. We're seeing changes on the federal level, as was mentioned, Medicaid, possible loss of Medicaid expansion. We are seeing changes in eligibility for those programs. On the state level, you are looking at potential state-level efforts to limit levy funding for different sorts of programs, to change some of the formulae that are used for reimbursement. Potentially, I hear tell, maybe all your property taxes are going to go away. Well, if that happens, I guess it's yay for you as an individual, but oh my God, for the rest of us. So these are issues that are really very important, and I'm just telling you this because I want you to know that I am not going to speak to you in a detached way about sort of highfalutin philosophical concepts. I am very, very, very tuned into the practical applications of what we're about to talk about. Okay? The only ground rules that I always put down before I speak are, number one, open your mouths. If you ask my wife what it means for me to be a philosopher in the real world, she will tell you I am a professional arguer. I enjoy a good argument. You do not need to believe what you say, by the way. You can play the devil's advocate. You can experiment with an alternate point of view. I only believe half of what I say. The rest is bait designed to draw you in to a good argument. So feel free to experiment and explore different perspectives. Even if you think ultimately they might fail, there are usually nuggets of value even in arguments that we don't end up adopting. So that's ground rule number one. Ground rule number two is no grudges. Okay, so don't say, oh my God, I can't believe what she said in that session. For all you know, she was playing the devil's advocate. I mean, you can hate each other for the right reasons, but not for anything that gets said in the next 40 minutes. So we're here to talk about allocation of resources. And I see some familiar faces in the room, so this is going to be review for a lot of you. And it's a very condensed version. But I want to start by sharing with you just a couple of opening cases. And by the way, I might move around. I think, yeah, I got microphones over there. I don't work well when I stand still, so I might be moving around a little bit. One case that I like to start with is a case, it's a real case. It is the case that kicked off a lot of my work in this area. You'll notice that this one is a case that deals with an individual with intellectual disabilities. My single largest contract, although I work with long-term care and hospital systems and hospice provider, every kind of platform you can imagine, my single largest contracts with the Department of Behavioral Health and Developmental Services in Virginia. And this case came up quite a long time ago, and it sort of kicked off this effort. So to bookend sort of my work on allocation of resources, I'm going to describe to you this case in a moment, which is an old one. I'll let you know that during COVID, I was asked to lead an effort to develop a policy on ventilator triage, which is probably about the pointiest end of the stick when you think about allocation of resources. And I continue to do the work with the Ohio Adams boards on their processes for making financial commitments to providers in the community. So this case is one of my favorites, and it really splits groups. Let me just describe this to you. I'll read it to you, and then I got to tell you a little more about it. Mr. Z is a 19-year-old individual with intellectual disabilities who's been receiving specialized services through the school system in his locality. Mr. Z has decided that he does not want to go to school anymore, and his family has been looking for appropriate assistance in the community. They've requested services from the CSB, but funding is scarce. The CSB, by the way, Community Services Board, that's our Virginia equivalent, I guess, of your Adams board. You guys split mental health and IDDD in a different way than we do. So this is community-based providers for mental health, IDDD, SUD, and prevention work. Okay? So that's what a CSB is. So the CSB says funding is scarce. We don't have a lot of slots. In fact, in this case, funding wasn't even the issue. Mr. Z requires intensive supports, and the CSB has determined that it would prefer to use its resources for individuals who have no other options. Is it ethical to refuse to provide services to Mr. Z because he is eligible for school-based support until his 22nd birthday? He's guaranteed school-based support through his 21st year. I've got to move. All right, who's in charge? Turn it on. Wow, you're asking a lot from me. Hello. Beautiful. All right, so this is not the full story. This is like what you get on one slide. So let me make sure you understand the story. Monday morning, Mr. Z shows up, and he has a very specific set of needs. He is 19 years old. All of the kids he grew up with have graduated from high school. He feels like he's been left behind. He gets what he needs from the school system, but he's not happy. And he wants to move on to something else. So he wants community-based services. So he goes to the CSB to get them, which is the right move to make. He shows up with mom and dad. Actually, they show up with him in tow. But he has very specialized needs. Now, it turns out, and this was just magnificent, that we had one slot available in a very specific program that was like tailor-made for Mr. Z. Could meet all of his needs, could help him do very well. Not a school-based program, exactly what he wants. There's only one slot available, and some of you, I see a smile already, you probably have lived through this. There actually was funding available to support this. But the funding came in a non-fungible tranche. In other words, it was like a waiver slot. It had to be applied to a person. It's not like I could take 10% of the money and put it there and 50% of the money and put it there. I had to assign it to an individual and say, okay, this is your money. You can use it for this program. This is a match made in heaven. Everybody's ecstatic on Monday morning. The Z's cannot believe their good luck. The case manager who's doing the intake says, this could be perfect. Listen, I got to make some phone calls. I got to, check out the details. Come back tomorrow afternoon and I'll have some paperwork done and we'll see what we can do. The Z's leave thrilled. They're going to come back Tuesday afternoon. Tuesday morning, Mr. X shows up. Mr. X is identical to Mr. Z in absolutely every way. Same set of needs, same likelihood of benefiting from this slot in the program, and in fact, same eligibility to draw down the funds that would support the community-based provision of services. There's only one difference between Mr. X, the guy who came Tuesday morning, and Mr. Z, the guy who was here on Monday morning. Mr. X is 25. He's not eligible for school-based support. Mr. Z showed up first. Mr. X shows up later, but he doesn't have a school to go back to. Immediately, the team was split. Half the team said, well, Mr. Z should get it. I mean, he was here. We got him all excited. He first come, first served. Half the team said, you got to be kidding me. Mr. Z can go back to school. Might not be happy about it, but he can. Mr. X is going to crash and burn if we don't give him support. Show of hands in the room. How many think the money should go to Mr. Z? Raise your hands. Guy who came in Monday. I got one. I got another. I feel like I'm running an auction here. I've got another one. All right. How many people think, no, Mr. X should get the slot? Ooh, I think we got a majority on that one. How many abstained from the voting? How many refuse to raise your hand no matter what I ask you? I want to know who they are. That would be good. Why did you abstain? What do you need to know that you don't know in order to make this decision?
Well, I actually don't work in this industry. I work in the farmers market, nutrition-based industry.
Okay. But you're a smart person. You can think about it.
I am, but I don't know enough about the situation, how this funding works, how these organizations work.
Oh, I'll tell you all that. The funding is available to either one of them. It will work. The program is there. There's no technicalities you need to worry about. This is an ethical question about who should get the slot.
I think it goes deeper than that, though.
To what?
What does the school actually offer? Is it
Exactly what he needs, but he's not happy there.
Well, I still don't know if I have enough information.
Oh, well, okay. So you don't want to make a decision. I mean, I will clarify whatever you need to know.
What are the transportation available?
Equal.
Everything.
Equal. Equal. I'm telling you, the only difference between these two individuals is eligibility to receive services through the school system, which Mr. Z has, versus lack of eligibility to find alternative resources, which is Mr. X's story. Now, if you think we can overcomplicate this, but that's what it boils down to. And I promise you, whatever you ask me, I'm going to say equal. Okay? If there were any other answer, you wouldn't need an ethics consult, right? So this comes to me because this actually does split staff. And don't think that it's just, oh, this is what the folks in IDDD worry about. How many of you serve patients who could go to the VA, and yet you have a wait list? Is it ethically reasonable to say, well, look, if you have eligibility to go to another place for your services, then you're going to be a lower priority for us? Like, we don't just take you because you show up. I mean, that would be great if we had all the money in the world, but we don't. So we need to prioritize. In order of priority, we need to determine who receives when not everybody can receive. That is the question on the table. I saw a hand up. No? No. What's your name? Michelle? Are you telling me the truth? Sometimes people hide their identities. Okay. Michelle is talking like a typical American, which is a bad thing in this particular case. We have been acculturated to believe that whenever you face a scarcity, there is a logistical solution. I will not tolerate anyone who says, if we only ... That is an unacceptable answer. If we only did it this way, we could serve both. If we only did that. Or you know what? If there's a shortage, guess what you do? Grow the economy. Then there's no more shortage, okay? No, the reality is we have to make a decision. We have to make it now. We can't wait for 10 years for the tax systems to change or whatever else. We have real people in real time who need a real answer, and we are constrained by the restrictions in our environment. Practical ethics, and this is maybe where clinical ethics differs from medical ethics or even bioethics. I do clinical ethics. Clinical ethics is, I have to make a decision today. I can sit and wish that the world were different. And maybe there are some of you among here, go, do, lobby, try to change the world. I'm not out to change the world. I'm out to make the best possible ethical decision I can in the world that exists. I got to play the hand I'm dealt. And this is the hand I've got. Yeah.
Can you take into consideration that even though he has the option for school-based support, if he's unhappy, he may not take it?
Yes, absolutely. Beautiful, beautiful point. If I'm going to repeat because maybe y'all didn't hear. Michelle, right? Yes. Michelle says, could you take into account the fact that Mr. Z might be so unhappy when he goes back to school that the quality of his care is actually going to deteriorate, right? He might not be cooperative, whatever. Sure you can. But you also have to take in the fact that Mr. X might die if he doesn't get it. So yes, good thinking, but now you're still involved in a comparative analysis of the implications of saying no to Mr. X versus the implications of saying no to Mr. Z. Right? So yes, that is an absolutely, if it turns out that Mr. Z will go back to school and commit suicide, well, now we've got something serious in play. If he's going to go back to school and be unhappy, and he's going to have to stay there for another year until another waiver slot comes, and it's not going to be great for him, but he'll still be okay. He'll be safe. He'll get some developmental supports. That could be a hell of a lot better than what's going to happen to Mr. X. So I do need to worry about Mr. X. Does he have a natural family support? I want to know what's going to happen to each of these people. Now, this, Michelle, is going to be key. I'll give you I don't know if it's a platinum star. I'll give you a gold star right now. Although gold's doing well these last few days. So are we going to make the decision based on how we can achieve the best outcome for the individuals served, or how we can achieve the least worst outcome for the person not served? Now, this is going to be my segue because I've already blown too much time. So just keep this case in your head, okay? This is a case that has to do with, as Michelle points out, the ramifications of choosing one versus the other. Quickly, I don't want to debate these because I just don't have time. Both Ms. H and Ms. I will do very well with therapy A, but that therapy is so intensive that staff can only provide it to one client at a time. Both Ms. H and Ms. I will do marginally well with therapy B, and that service could be provided to both simultaneously. Is it preferable to maximize outcomes to one individual at a time or secure marginal improvement for multiple individuals simultaneously? simultaneously. Imagine your choice. You can do group counseling, which meets the minimum standard of care, but it's not going to be a breakthrough for anybody. Or you could do individual counseling, and the person that you target is going to have great results. Of course, you leave someone else in the dust. So if the first case is what happens when we say no to someone, the second case is what are we actually shooting for here? Is it better to serve more, less well, or fewer, ideally? And this is going to be a painful part of the allocation of scarce resources, because I know you all, I could write your mission statements. We are the preeminent provider of X and community Y. Okay, great. You're all want like bells and whistles, okay? Is there a point at which we just can't afford the bells and whistles? And I don't mean not for everybody. I mean, we're making a choice not to secure bells and whistles for some because we're putting our priorities somewhere else. What I'm really talking about here is not zero-based budgeting. I was on city council for 12 years and I wrote a lot of big budgets, and I know all about the different ways people approach it. Incremental budgeting. Start with where you were last year and tell me why you need to make any changes. Zero-based budgeting. Nobody gets anything. We have to rebuild the budget every year. You start with an assumption of zero. You justify what you need. I'm throwing both of those out and replacing it with what I would call priority-based budgeting. Okay? How do we identify our priorities? And then how do we use our money to achieve those priorities? Because I will tell you, and John, you've heard me say this I don't know how many times, the most important ethical document you have in your organization is your budget. And I'm not arguing that your budget is either ethical or not ethical. What I mean is, you can tell me, you can show me all sorts of missions and value statements, and they're beautiful, and you laminate them and put them in multicolored brochures. But if I really want to know what you care about, I'm going to look to see where you spend your money. Your budget tells me more about your ethics than any mission statement you ever wrote. Now, it doesn't mean mission statements are useless. They're very important, and they should align. How should I say this? Your budget should align with your mission statement. But if there's a disconnect between the two, I'm following the money. Third, we have a hand up over there. Then I want to give a third case. Go.
Mr. H and his I.
Yeah.
If we were to give Mr. H the gold star treatment,
Yep.
and at this point Ms. I nothing, would Ms. I deteriorate, or would you give her the gold star treatment later?
Oh, well, good. You're reinventing this case to actually just be a repeat of the first one, right? So that's great. If you want to go back to case one, we can go back to case one. It's a fair question, right? So you do need to worry about what happens to the person who has refused the service, okay? That is why I give you the first case, to sort of bring out that intuition, right? The second case absolutely has those elements. You are right to worry about that, right? Like what is the delta in efficacy between the gold standard and the second tier, right? Like if there's a minimal difference between the two, we're not going to sweat this. We're not going to spend a lot of time on it. But if there's a significant difference between the two, ethics is going to be in play. So the second case really is designed to bring out the intuition of numbers, right? Star Trek true. Wrath of Khan. Yes? Spock. Tell me. The needs of the many weigh the needs. Oh, you even got the quote from the end of the movie, or the one. You look too young to have watched Star Trek II, The Wrath of Khan. But it's the only version worth watching of all the Star Trek movies. Anyway, so this is a numbers game. What was that?
That's false.
Oh, okay, there are... All right. Okay, yeah, we're going to have another half-hour talk about that. The whale one, really? Come on. Spock dead? No, all right. So, third case. So, case number 2, numbers game. Third case. Ms. K and Ms. L are both under consideration for placement in your vocational program. Ms. K has many more challenges than Ms. L and is less likely, therefore, to succeed with long-term job placement. While Ms. L is more likely to move through the program efficiently, she has a more substantial family support system and can do better without your support. Should Ms. K or Ms. L receive the next available slot in the program? I'm just going to tell you now because we're running out of time. The goal of sharing this slide with you, which makes it distinct, it shares elements with the first two, but what makes this one distinct is that we are putting efficiency into the mix. Okay, so we have one person who's going to do really, 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 really well. We have another person who's not going to do so well. However, the person who's not going to do so well does not have the natural support system that is going to keep that person safe and healthy. And so now we're asking again the question about how much we actually value efficiency. And you mentioned a couple of words in the introduction that are dangerous fighting words. Okay, you mentioned equity, which I guarantee you only understand 90% of it. Okay, so you need a deeper dive on what equity actually means. And you mentioned efficiency, that we want to use things efficiently. That hit my ear. Does efficiency really matter? I mean, it could, but is it an ethically driving force? Is it intrinsically valuable? Is efficiency something we want for its own sake? Or is efficiency something we want only because it allows us to extend our commitment to equity? That's going to be a core issue. So let's get these concepts on the table. And seriously, this is a full day, okay? So I'm just scratching the surface and giving you some food for thought. We got to have much deeper conversations about how this is operationalized. And it's all about operationalizing. This is not just an academic conversation. I would suggest to you that when we think about the allocation of resources, we need to consider what I call the 4 E's of allocation. Although based on some executive orders, I might have to change the 4th one to an F instead of an E. Might have to call it fairness instead of equity. I think that we're not allowed to say equity too much anymore. 1, efficiency. Let's be clear about what efficiency means. A maximally efficient outcome is one that provides the highest ratio of output over input in a system. Efficiency does not consider the distribution of outcomes across recipients, but only the return on investment that is generated. That's what you said in your opening comments. You wanted to talk about return on investment. We're gonna put our resources in a certain place. We're gonna get something back for that. Doesn't necessarily mean economic return, right? It means return in terms of satisfying our goals. But nevertheless, it's a ratio of investment to return on investment. You put 10 units into a system, you get 10 units out. It is perfectly efficient. It's a 100% efficient system. No drag, no profit, perfect efficiency. You put 10 units in, you get 5 units out. We got drag in that system. It's a 50% efficient system. You put 10 units in, you get 20 units out. We got value added. We're making profit, right? It's a 200% efficient system. Notice that I can assess efficiency only on the basis of the ratio between input and output from input to and output from the system. There's nothing in efficiency that actually tells me what to do with the resources I've generated. It might be highly efficient to sink all of my effort into one person and ignore everybody else. I don't have to start and stop. My documentation will be more streamlined, right? So I could really concentrate on one and it would be wickedly, someone who wrote that title for this afternoon must have come from New England. It would be wickedly efficient. And yet we might ask, ooh, really? Is that what we want? Just concentrating resources because it's efficient? There are other values to consider. Second value, effectiveness. A maximally effective outcome is one that maximizes benefit to the recipient of the resources or services in question so as to bring about the greatest gain for the chosen recipient. When we consider effectiveness, we apply the economic principle of max, which means obtaining the best possible, best case outcome. If you're worried about effectiveness, you want those bells and whistles. And you're going to put your resources in a place that returns a success story that you want to shout from the rooftops. Okay, that's effectiveness. It's concerned about the winner. Equality is another concept that we have, and this is the easiest of all of them to understand. It's the most intuitive. An equal distribution is one that maximizes the degree of similarity of outcome for all recipients of goods or services. So if I spend $5 on one person, I should spend $5 on someone else, perfectly equal. And then finally, the concept of equity. A maximally equitable distribution of goods or services is that which minimizes harm to the non-recipient of resources or services in question so as to bring about the least harm to the least advantaged recipients. When we consider equity, we apply the economic principle of maximin, obtaining the best possible worst case outcome. You want to know that the person who's hurt the most by the decision you made is better off than the person who would be hurt most by any other possible decision you could have made. That's equity. The little 3 kids standing behind the fence, watching a baseball game, bad picture, right? Because it fools you into thinking that if you just rearrange the boxes right, all their heads will be on the same level and you will have achieved equality. Well, that gets about 80% of equity right. The investment we put into an individual cannot be justified simply by comparing it to the level of investment we make in someone else. Some people are going to require greater supports than others. If you behaved solely on equality, what would you do in your hospitals? Right? Some patients are sicker. They require more intensive supports. That's not equal, but you would argue because one person has a greater need than another, it's perfectly equitable to spend a greater share of the resources on the needier folks than on the folks who will be fine without your help, or at least won't be as bad off. That little 3 kids behind the fence makes you think we're still shooting for all their heads at the same level. I want to correct that. Equity does not assume that we're going to get everybody able to see over the fence. What equity says is we got to make sure that the shortest kid in that picture at least gets a view. It might not be as good. We may never be able to get that kid seeing as well as the tall kid. But if we can get him just up to the level where he can look through a knothole and watch the game, maybe that's the best we can do. And that would be equitable, even if it's not equal. All right, I got to keep moving, but I saw a hand maybe pop up. Question? No. No? No. Really?
I was just taking a picture, sorry.
Oh, okay. All right, fair enough. I usually do an exercise here that's going to take another hour, and we don't have it. So I'm just going to jump right to some conclusions. And if you want to play that game with me, invite me back for another session, and we'll do a breakout, and we'll have plenty of time to argue it. But basically what I'm arguing is the following. I'm going to show you 2 sort of slides that explain the differences between these 4 concepts. So this first matrix has person A and person B, or group A and group B on the left-hand side, and 4, this is not a very bright thingy, 4 distributional schemes, alpha, beta, gamma, and delta. Got to use my Greek major at some point. So there are 4 possible ways that we can distribute the resources we have. Just please, just believe me, these are the only 4 options you've got, okay? Alpha, beta, gamma, and delta. Now notice, in world alpha, person A or group A gets 1,000 units of whatever it is we're distributing. Dollars, time, support, you fill in the blank. Person B gets 25 units. Now I want to point out that this is the maximally effective world. The winner wins biggest. You have 1,000 points of value is greater than 950, greater than -5, greater than 500. The winner wins biggest. If you're worried about effectiveness, world alpha is your world. Go for it. But most people look at world alpha and they say, yeah, it's effective, but that doesn't seem right. I mean, why are we helping A to soar and we're leaving B in the dust? So they think, what's the typical move people make when they think about allocation of scarce resources? We've got to be more efficient. All right, look at world beta. Person A gets 950 units of whatever we're distributing. Person B gets 100 units of whatever we're distributing. The total output from the system is 1,050. It's greater than 1,025. It's greater than, what's that, -12. It's greater than 800. World beta is your maximally efficient world. Assuming that the investment across all 4 possibilities is the same, the biggest return on your investment comes in world beta. It's the maximally efficient outcome. And yet people look at that and they say, oh, whoa, but there's still this huge disparity between A and B. This doesn't seem right. So the natural move then is to say, well, look, if the disparity bothered us in world alpha and the disparity bothered us in world beta, it must be the disparity that bothers us. So let's go to equality. Guess what? World gamma is your most equal world. We don't help anybody, but we hurt everybody just about the same amount. It's perfect. I mean, I could make it -10, -10. It would be perfectly equal. But this is pretty close. -7, -5. I don't help anyone. Everybody's left worse off, but they're close to equally worse off. World gamma is your most equal world. Is that the world we should prefer? I would just ask you this question. Would you rather live in a world where we are equally unhappy or a world where we are unequally happy? Look at world delta. Person A gets 500 units of whatever it is we're distributing. Person B gets 300 units of whatever it is that we are distributing. That is the equitable world. Now, B might say, that's not fair. Why does A get more than me? Not fair. And we would respond by saying, excuse me, B, the only world in which A doesn't do better than you is a world where you do substantially worse than you are right now. Now, do you really want to trade world delta where you get 300 units of whatever you want for world gamma? The only world where you're doing better than A? If you say yes to that, I just think you're spiteful. That's called cutting off your nose to spite your face. That's ridiculous. Another way to look at this. Another way to look at this. And this is for the economists in the room. Any financial folks here today? Good. Okay, so you got this. There's one. Oh, timidly. Yeah, I'm a finance guy. Here's a graph of possible distributions of resources that we've got. We have an A axis and we have a B axis, okay? So person A, person B, or group A or group B. And we're gonna distribute everything we've got. Now, there are a few things you need to know about this slide. First of all, there is I wish this were brighter. There's this 45-degree-ish line that goes here. This line. That makes a 45-degree angle. The economists are very clever. They're really fun folks. They have a special name for this. It's called the 45-degree line. Okay, so that's really cool. The 45-degree line is the connection of all the plots of equal distribution between A and B. So in other words, if you gave 1 to A and 1 to B, you would plot a point on that line. If you did 2 to A and 2 to B, it would be a point a little higher, and out it moves. Right? So you need to understand that any point that's plotted below the 45-degree line is a situation where B is doing better than A, and any point that's plotted above the 45-degree line, A is doing better than B. There's another curve that you need to understand here, which is that rounded curve that's further out. That is known as the Pareto optimal curve. So Pareto optimality is the horizon of maximal distribution. We're giving away 100% of what we've got. So you can't get outside the Pareto optimal curve. You run out of stuff before you do. So that curve is as far as we can go. So if you were to give away 100% of what you've got, and you gave it all to A and none to B, you'd plot a point at the intersection of the A axis and the Pareto optimal curve. If you gave everything to B and you gave 100% away of what you've got, you would plot a point at the intersection of the Pareto optimal curve and the B axis. If you give away 100% of what you've got and you give it away equally to both, then you would plot a point at the intersection of the 45-degree line and the Pareto optimal curve. Everyone understands this graph. It's not that complicated. But 10 minutes, we're right. If we are at point alpha and we have the opportunity to move to point beta, ethically, should we do it? Is it fair? Is it equitable? Now notice, we're trading a point below the 45-degree line for a point above the 45-degree line. That means we're moving from a situation where B does better than A, we're trading it for a situation where A does better than B. Does B have grounds for complaint without being a spiteful, nasty little person? I want you to notice that although we are clearly, by making the shift from point alpha to point beta, we are clearly moving way up the A axis. So A is clearly the greater gainer in that move. Beta is still further out on the B axis, which means it costs B nothing. In fact, he's better off if we move from alpha to beta. And I would argue there is no ethical reason in the world why B should be uncomfortable with that move. The only time where equality and equity could converge would be on the Pareto optimal curve. But now we get back to the logistical argument. If you are at the intersection of the Pareto optimal curve and the 45-degree line, and you want to make a choice to move to a different point, you've now got a zero-sum game. In order to improve one, you have to take it away from the other. That's when someone could say, that's not fair. Why are you harming me in order to benefit someone else? But inside the Pareto optimal curve, equality and equity are 100% different concepts. What does this actually mean? And I'm going, fast here. A fair approach to rationing is one that seeks to maximize benefit to the least advantaged member of the group. That's the concept of equity. Once minimum standards are met for everyone, additional resources should be used to improve the situation of those who are least advantaged. Rationing a public resource, and I stress the word public, I don't necessarily mean that in the typical way of public. I mean previously uncommitted funds. So no one has a pre-existing claim. You put private property in the mix, you change people's rights to be able to control their property. So I'm talking about resources to which neither A nor B have a prior claim. Rationing a public resource is morally justified if and only if, one, there actually exists a shortage of the resource in question. Don't say no unless you have to. Two, an identifiable victim of a failure to ration exists. In other words, if you sit on your hands, somebody gets hurt. So inaction is action. You choose not to act, you're making a choice to maintain the status quo. And three, the victim of the adopted rationing scheme is disadvantaged less than the victim of any other rationing scheme, including the lack of rationing altogether. In an environment of true scarcity, our goal must be to minimize the harms done, Michelle, rather than maximize the benefits received. When allocating scarce resources, our only constraint on the lower end is to satisfy minimum standards of care. And of course, you have mandates too that you need to satisfy, which I'll mention in a moment. What this basically does, as I'm getting very close to the end of my time, is it creates the basis for a very pragmatic approach. When that Mr. Z case came up, we dealt with it. And soon thereafter, the organization that invited me in to consult on that said, Mike, we need a policy because we don't have one. And we need to be consistent, and we need to make sure that all staff understand how to do this, and it has to be true across programs. You can't just depend on, well, if you're a friendly provider, then you'll get a yes, but no, that person's not friendly. I was going to use a worse term than that. I would save that for the Star Trek fan. What do we actually come up with? First, exclusionary criteria. You are not here to fix the world. You want to know how you can save the most number of people? I got news for you. Close your doors. Send every penny to famine relief. You'll save more lives. But you know what? You're not a famine relief agency. You have a mission. You exist with a particular goal in mind, which means you can exclude from consideration even people in need if they do not meet criteria to be subjects of your concern, if they're not appropriate constituents. They don't live in your, Virginians shouldn't ask Stark County for mental health supports. Go to the CSB for that, right? Or if they ask for they make inappropriate requests. They ask for services that you're not designed or licensed to carry out. Exclude them from your concern. They're just not your headache. Sounds tough, but they're out. Okay, we still have a lot of people now left in the pool who are legitimate subjects of our concern. The order in which we pull them out of that pool is going to make all the difference, because at some point we're going to run out of money, and when we do, whoever's left in the pool is not going to get. So what's the order in which we then prioritize the services that we offer? One, if we've made a prior commitment, we're probably going to have to keep our word. That would be a part of a deeper argument about Mr. Z if we had the time for it. If we've already promised something. Now, this does not mean that you cannot change your programs. This is on a micro level. This is individual level. You are at least going to have to transition people out of programs if you decide you want to close them. You can't drop people cold turkey. Okay, I would put mandates in this as well. You have prior commitments that you just have to satisfy. They're non-negotiable. All right, if we have any resources left over after we've met those prior commitments, let's look to see who's most in serious need. And that's going to be defined as individuals at imminent risk who have no other alternatives. They can't get that need met anywhere else. We're going to treat them next. All right, we pluck them out of the pool. If we still have resources left over, now we can worry about efficiency. Not because we care about efficiency intrinsically, but because if we're really efficient, we might be able to spread our resources to help more people. So efficiency has instrumental value in supporting equity, has no intrinsic value itself. It comes third on the list. Once we're efficient so that we're trying to really serve as many as we can, now we can start worrying about the high end, the effectiveness. If we still have money left over after we have maintained our commitments, dealt with this with the most urgent needs, been as efficient as possible, tried for good outcomes, first of all, you're in la-la land if you have any money left, but if you do have money left, now you can go back to need. You can say, look, there are some secondary or tertiary needs. They're not quite as urgent, but they still create a qualitative difference between individuals. Let's look at those lesser needs. Prioritize on the basis of those. If you still have money left over after you've done all that, okay, everybody left in the pool is effectively equal. There's no way to slice them and dice them, no way to make any distinctions between them. At that point, random selection makes sense, and most people think that the best version of random selection is first come, first served. We're used to waiting in line, so now order of presentation could matter. Although I will tell you, order of presentation, first come, first serve is not as fair as you think, because well-educated people with private insurance who are salaried and can take time off from work are far more likely to get seen and be diagnosed earlier in the course of their illnesses than individuals who are hourly workers who can't come to the doctor until they're so sick they can't go to work, and then they show up in the ED where there's no health history on them and we have to start from scratch. So the reality is the wealthy, intelligent, educated, connected folks are still going to do better in a first come, first served system. Nevertheless, it might be a negligible difference. I don't know if that's true, but it's something we're accustomed to. We can use that as random selection. There is a macro allocation analog. So I've talked now about micro allocation, and to sort of bring things to the end here, I want to point out that while this starts with thinking about person A versus person B, it quickly becomes a budgeting question. Where should we put our resources in our overall budget? And although it's very complicated, we can use that micro allocation model to tell us how to behave on a macro level. The exclusionary criteria, constituency, inappropriate requests, they just devolve into what is your mission? What are you here for? Are you an acute care hospital? Are you a community-based provider? Like, tell me what you do, and I'll know whether or not you should include or exclude certain programs from your support. There might be beautiful programs, but they have nothing to do with your mission. Don't fund them. It's not your headache. Even if you think in your heart of hearts, oh, it would be sweet if we had that. At that point, this is a very complicated slide, so you'll have to read it on your own. Prior commitment, you can leave that intact, or you can recognize that on a budgetary level, we can phase out programs over time. With appropriate planning and transitional supports, we can change the promises we make. Alternative resources, that becomes an analog to leveraging resources. So if I use resources in a certain way, does that generate more revenue? That actually means that alternative resources becomes part of efficiency. Equity is unchanged. If I have to choose between this program or that program, not this person or that person, but this program versus that program, I still need to ask, if I defund one of those programs or either one of those programs, will it leave people worse off? I'm still concentrating on maximizing the welfare of the least advantaged person based on the decisions I make. So if I choose not to buy another helicopter for the hospital, someone's going to die in a car accident on the highway. But on the other hand, if I choose not to upgrade my OBGYN services, we're going to have worse outcomes for mother baby. Okay, I want to know, which is worse? Fund the program that I know, time's out, here comes the hook. Okay, quickly then, we get to efficiency. You can leave that intact. Effectiveness, there's a debate to be had about whether or not efficiency or effectiveness are your higher priorities. That's going to depend on the personality of your organization. So we can have that debate. And when we get to comparative need, we replace that with the consideration of public opinion. You work in a political environment, and you do have to satisfy expectations of the communities in which you work. And so those do have value, but notice they're lower on the list. And finally, random selection. There's no place for random selection when you're writing your budget. You have the time to think about everything you put in that budget. All right, so to end, 2 slides to end. Give me 1 minute, 2 slides to end. Identify the range of services to be offered over time. So you got to begin with your mandates, your mission, and demands of considered public opinion. Maintain a commitment to provide those services because that's who you are. Spend additional resources once you've met those minimum requirements in order to limit the harms of budget cuts. That's the instantiation of equity. Select programs that leverage resources to increase fundings for step 2 and 3. So efficiency matters, but it matters in service to equity. Select programs with high and measurable success rates. You'll come up with a budget. At the end of that process, you have to ask yourself, does the budget that just spit out from this match the step 1? If they're out of sync, you're going to adjust one or the other. You got to either change public opinion, right? Or you got to change your budget. There has to be what we call reflective equilibrium between the beginning of that process and the end of the process. So I will end by just leaving you with a series of questions, 5 questions. 1, what's the difference between a hard mandate, a soft mandate, and a contingent mandate? A lot of people think, oh, it's a mandate, I got to do it. Just be sure that that's true. Hard mandate, you have to do this to this degree in this way. Soft mandate, you have to have a program that does this. You spend $1 on it, you've satisfied the mandate. It's really up to you to figure the rest out. Contingent mandate, you don't have to do it all, but if you take $1 from me, all of these things are going to snap on. You have more control over mandates than you think. There are very, very few hard mandates. Don't take grant crack. Okay? If it's going to cost you more to get the job done because you took that federal dollar, don't take the federal dollar. 2, does equity always take priority over efficiency? What if increased efficiency enhances opportunities for equity? Efficiency is great, but remember, equity takes precedence over efficiency. Efficiency is here to serve equity. How should we respond when budgetary demands from state and local funders conflict with our priorities? Guys, you have to be answerable to your political subdivisions, okay? You can lobby, you can try to change that, but you're going to have to work within that context. How should we respond when budget cuts will cause demonstrable harm? Make sure the harm you're causing is less than the harm you would have caused if you had made any other choice. I'm telling you right now, you're going to cause harm. You don't want to hear it. That's the name of the game. And finally, is it ethical to maintain reserves in a time of scarcity? Sure it is, but don't over-reserve. You need a reserve for operations, right? Because you need to be able to cover budget if money doesn't come in on time. You need a reserve for contingencies. There's a certain amount of emergencies that come up, and you can hold some in reserve to handle those anticipated but unknown emergencies. And you probably also need a capital reserve, right? You don't want to have a bunch of deferred maintenance and then it costs you more later. So you can have a capital reserve, you can have a reserve for contingencies, you can have a reserve for operations. Beyond that, you should be trying to expend every dollar you've got. And I've expended every minute that I've got. So I will stop there. Thank you very much.
All right. I feel like I just took a whole college level course in about 40 minutes. A lot to digest there. Thank you very much. This is a good time to let you all know that the slides are posted on our website. So I saw a lot of folks taking pictures of the slides. You don't have to do that. You'll be able to access them online. And then we have another exciting announcement. Through the generosity of one of our funders, we are able to record all the plenary sessions today and make those available for viewing later. So if you want to digest this by watching it maybe another 8 times, you can do that after the summit. Just a quick reminder that if you are wanting to get continuing education credits, you do need to sign in at the registration table, so make sure that you have done that. And with that, I will release you all to your breakout sessions. You had an agenda in your reminder email that was sent by either Alana or Jasmine. And that has the sessions that you signed up for. There's a map, again, on the back of your program that will help you find your room, and our staff will help you as well.